What is anxiety disorder in people aged 50? Anxiety disorders are among the most common mental health conditions worldwide, and they don't discriminate by age. For people around 50 years old, anxiety can take on unique forms, influenced by the physical, emotional, and social changes that often accompany midlife. While anxiety is a normal human response to stress, an anxiety disorder goes beyond occasional worry. It's a persistent, overwhelming condition that interferes with daily life. Understanding what anxiety disorder looks like in individuals at this age is key to recognizing its signs, addressing its causes, and finding effective ways to manage it. Defining anxiety disorder. An anxiety disorder is a mental health condition characterized by excessive, uncontrollable worry or fear that lasts for weeks, months, or even years. Unlike temporary nervousness, say, before a big presentation, an anxiety disorder involves symptoms that are disproportionate to the situation and difficult to shake off. The Diagnostic and Statistical Manual of Mental Disorders M5 recognizes several types, including Generalized Anxiety Disorder, AD, Panic Disorder, Social Anxiety Disorder, and specific phobias, all of which can affect people at 50 in distinct ways. For someone in their 50s, anxiety might not always look like the stereotypical image of a nervous young adult. Instead, it often intertwines with midlife challenges such as health concerns, family transitions, or career shifts. According to the National Institute of Mental Health, NIMH, about 10 to 15% of U.S. adults aged 45 to 64 experience significant anxiety symptoms, making it a prevalent issue in this age group. Symptoms of anxiety disorder at 50. The symptoms of anxiety disorders in people aged 50 can be both physical and psychological, often overlapping with other age-related conditions which can make diagnosis tricky. Common signs include psychological symptoms, persistent worry about health, finances, or family, difficulty concentrating, irritability, or a sense of impending doom. For example, a 50-year-old might obsess over whether they've saved enough for retirement or fear losing their independence due to aging. Physical symptoms, rapid heartbeat, shortness of breath, sweating, fatigue, muscle tension, or sleep disturbances. These can be mistaken for symptoms of menopause in women or heart issues in men, complicating identification. Behavioral changes, avoidance of social situations, reluctance to try new things, or over-reliance on routines as a way to feel in control. At 50, these symptoms might be triggered or worsened by specific life events, such as children moving out, empty nest syndrome, the onset of chronic illnesses, or the loss of a loved one. Unlike younger adults, whose anxiety might center on career beginnings or social acceptance, people in their 50s often grapple with existential fears, questions about purpose, mortality, or unfulfilled dreams. Causes and triggers in midlife anxiety disorders at 50 stem from a mix of biological, environmental, and psychological factors. Here are some key contributors. 1. Hormonal changes. For women, menopause around age 50 brings a drop in estrogen, which can heighten anxiety. Men may experience andropause, a gradual decline in testosterone, leading to restlessness or unease. 2. Health concerns. The 50s often mark the onset of conditions like hypertension, diabetes, or arthritis. Worrying about these, or fearing worse diagnoses like cancer, can spark health-related anxiety. 3. Life transitions. Retirement, whether planned or forced, can create financial insecurity and a loss of identity. Similarly, becoming a caregiver for aging parents adds stress and responsibility. 4. Social shifts. As social circles shrink due to friends moving away or passing on, isolation can breed anxiety. The empty nest phase may also leave parents feeling purposeless. 5. Past trauma. Unresolved issues from earlier in life might resurface in midlife, especially as people reflect more deeply on their experiences. For example, a 50-year-old American man might feel anxious about his job security as companies favor younger workers, while a woman might struggle with menopause-induced mood swings that amplify her worries about aging. These triggers are often unique to this age, setting midlife anxiety apart from other life stages. Types of anxiety disorders at 50. Several anxiety disorders can manifest or intensify around age 50, each with its own flavor. Generalized anxiety disorder, excessive worry about everyday issues like money or health that persists for 6 months or more. Panic disorder, sudden, intense panic attacks that might be mistaken for heart attacks, a common fear at this age. Health anxiety, obsessive concern about illness, often fueled by real or perceived physical decline. Social anxiety, fear of judgment in social settings, which might grow as confidence wanes or isolation increases. Take GAD, for instance. A 50-year-old might lie awake at night worrying about their spouse's health, their own retirement savings, and their adult child's struggles, all at once, with no clear solution. Impact on daily life. Anxiety disorders at 50 can disrupt work, relationships, and overall well-being. A person might avoid medical checkups out of fear of bad news, strain family ties with constant irritability, or withdraw from hobbies they once loved. Physically, chronic anxiety can worsen conditions like high blood pressure or insomnia, creating a vicious cycle. Emotionally, it can lead to depression, with the NIMH noting that anxiety and depression often co-occur in this age group. Managing anxiety at 50. Fortunately, anxiety disorders are treatable, and people at 50 have options tailored to their needs. Therapy, cognitive behavioral therapy, CBT, is highly effective, helping individuals reframe negative thoughts. A therapist might guide a 50-year-old to see retirement as an opportunity rather than a loss. Medication, antidepressants like SSRIs, e.g. sertraline, or short-term anti-anxiety drugs can stabilize symptoms, though they're often paired with therapy. Lifestyle changes, exercise, even 30 minutes of walking daily, a balanced diet, and mindfulness practices like meditation can reduce anxiety. For instance, yoga has been shown to ease menopause-related anxiety. Support systems, joining a support group or leaning on friends can combat isolation. Online communities also offer connection for those hesitant to seek in-person help. Why it matters. Recognizing anxiety disorders in people aged 50 is crucial because this demographic often overlooks mental health. In the US, cultural expectations of resilience, especially for middle-aged adults, can discourage seeking help. Yet untreated anxiety can diminish quality of life and exacerbate physical health issues common at this age. By understanding its signs and causes, individuals, families, and healthcare providers can take proactive steps. Conclusion. Anxiety disorder in people aged 50 is more than just midlife jitters. It's a complex condition shaped by hormonal shifts, health worries, and life transitions unique to this stage. While its symptoms, racing thoughts, sleepless nights, or a pounding heart, can feel overwhelming, they don't have to define this chapter of life. With awareness, professional support, and practical strategies, those in their 50s can navigate anxiety and reclaim a sense of calm and purpose. If you or someone you know is struggling, reaching out to a doctor or therapist is a powerful first step, because at 50, mental health matters just as much as physical health.